The public health movement began with the realization, as Harold mentioned earlier, that the illness of one individual often cannot be explained and cannot be cured simply by caring for that individual. There was a realization that many of our illnesses are produced by factors that have nothing to do with that person whatsoever and have everything to do with society. So this is a fundamental realization that personal responsibility isn't enough. John Snow, a 19th century British physician, is widely regarded as a pioneer of epidemiology and one of the founders of the modern public health movement. In 1854, Dr. Snow halted an outbreak of cholera in London by marking the location of new cases on a map. That map helped him connect the outbreak to a single water pump in Soho. So he disabled the pump by removing its handle, and the cholera outbreak ended. If you were to mark a map of the United States today, trying to find the source of our worst health problems, you would be led again and again to the same place, to the neighborhoods of the poor. That is where you will find the highest levels in this country of heart disease, of asthma, of diabetes, and HIV infection, of cancer, of infant mortality, and of drug addiction. That is where you will find the greatest public health problems of America. And those are the ones that private interests refuse to confront. One of the worst public health problems that we now face is one that Harold had talked about earlier, which is the obesity epidemic. Obesity has been linked to cancer, cardiovascular disease, asthma, diabetes, many of the leading health problems of the poor in this country. The Centers for Disease Control and Prevention estimates that obesity will soon surpass smoking as the #1 cause of preventable death. So we are talking already of hundreds of thousands of Americans prematurely losing their lives. Now, epidemiologists have found a wide variety of vectors for different kinds of epidemics. Mosquitoes for malaria, tainted water for cholera, dirty needles for HIV and hepatitis C. But more and more studies are finding that the leading vectors of the obesity epidemic are the marketing practices of companies that sell fast food, junk food, and soda. Companies that aggressively target small children with ads encouraging them to eat unhealthy food. Over the last 30 years, as fast food consumption and soda consumption have soared, the obesity rate among American toddlers has doubled. The obesity rate among American children aged 6 to 11 has tripled. If you were to plot on a graph the rise of fast food and soda consumption and the rise of obesity in the last 30 years, they chart very, very neatly with one another. This is a public health disaster. And as Harold mentioned earlier, the Center for Disease Control and Prevention estimates 1 out of every 3 children in America born in the year 2000 will develop diabetes because of his or her weight. And among the children of the poor, the children of color, we are talking 1 out of every 2, perhaps, developing diabetes. Now, the fast food chains are increasingly targeting low-income communities as wealthy people and upper middle-class people begin to eat much healthier food. This is a very similar tactic that the tobacco industry used. Once wealthier and well-educated people quit smoking, the tobacco industry focused heavily on low-income communities and on developing countries, which is exactly what the fast food industry is doing right now, flooding low-income communities with new fast food restaurants. If you go to the high schools in low-income communities, they are being ringed by fast food restaurants. More importantly, these companies are aggressively marketing to very young children. They are using the latest toys and games, the latest movie tie-ins and cartoons. They are providing playgrounds and clowns, doing anything they can to get children to want to use their products. And they have been selling in schools throughout this country, thankfully not in California. How young are they targeting children? Well, their own studies of the fast food industry has found that brand loyalty begins as early as the age of 2. But they are targeting children even younger than that because of how eating habits form. And both Burger King and McDonald's have done marketing deals with Teletubbies. Now, Teletubbies are these fictional characters aimed at pre-verbal children, children who are 8 months, 9 months old. And Burger King even sold chicken nuggets in the shape of Teletubbies. These are high-fat, high-salt, unhealthy foods aimed at children too young to speak. This has had incredible harm on the children of this country. And we have a very perverse food culture at the moment. On the one hand, the mass media is promoting thinness and directing at young women and girls body images that are completely unrealistic for most women and unattainable. And at the same time, the mass media is promoting this unrealistic body image of thinness. The food industry is promoting obesity through its marketing practices. This is a huge problem for America's children. Studies of obese children have found that they suffer depression in many ways the same as children who are undergoing chemotherapy for cancer. So this is a great psychic toll that very often will be lifelong. But our children are suffering from incredible health problems. And I've spoken to pediatric surgeons who have performed heart bypass surgery on teenagers because of how obese they are. We have teenagers in this country who are having heart attacks.